I'm Matthew Delaney. It's 2024, and if you're in the US, you're well aware that it's a presidential election year. We're voting in a couple of months, and I'm not gonna get into politics. I'll just tell you this, the leading candidates, anytime I see these folks, I start to think about elderly falls or the risk of elderly falls. And we see this a lot clinically, right? When an elderly patient falls, the chance that they have an intracranial bleed is about 7% across various patient populations. Now, the challenge is trying to figure out who needs a head CT, but I think even more difficult is figuring out who may not need a head CT when you're looking at patients who are elderly who fell to the ground. And some of the things that help us predict the risk of bleed are obvious. Loss of consciousness, signs and symptoms of trauma to the head. But then there's another piece. It is that the patient remembers falling and hitting their head. Now, that remembering, did you hit your head? Yes, no, that's actually a really important piece of the puzzle, because if we look at the predictive power, it's not loss of consciousness, it's not signs of trauma, it's the patient saying, I hit my head, that has the strongest association with us finding a bleed in their brain. So it raises the question of, it's easy. If you fell and hit your head, you got a big hematoma, you lost consciousness, and you said, yeah, I definitely nailed my head. That's a no-brainer. I'm gonna get a head CT 100% of the time. But what about the patient who fell, who's elderly, who looks okay, I don't see signs of trauma, and when I ask them, did you hit your head? They say, I'm not really sure. There's an interesting paper out that I think gives us some guidance in that scenario, the well-appearing patient who fell, who doesn't know if they hit their head. This was a prospective look at about 4,000 patients in the ED, all elderly patients who fell. And the authors did a cool thing here. They broke them into two groups. So the first group was the definitely hit your head group. And these were based on, did you have signs of trauma? Did you remember hitting your head? Did you have a loss of consciousness? The other group was the uncertain group. And these were patients that didn't have obvious signs of trauma, and most importantly, didn't know if they hit their head. When you look at the two groups, the rates of bleed were pretty dramatically different. So there was about 11.7% in the definitely I hit my head, I remember hitting my head group. But in the I don't know, I don't have signs of trauma group, the rate of bleed was still about 1.7%. And in that uncertain group, I don't know if I hit my head, 0.3% of those patients needed a surgical intervention for this brain bleed. So when we think about it, how do we set the threshold correctly for when should we image an elderly patient, even if they don't have signs of trauma above the clavicle, even if they don't know if they hit their head? And this paper has pushed me to say, I think I'm gonna have a really low threshold to image these patients. Number one, I wanna know if the patient's got a bleed in their brain. I'm reassured that only a subset needed a surgical intervention. I still would like to know if it's my grandmother who has a subdural. I would just be able to base what we do next a little bit better with that piece of the puzzle. The other thing, we do a lot of things in the ED to reduce imaging. And I want to pitch you that getting a head CT in an elderly patient is a fairly benign intervention, right? So what are the risks of CT? Well, we can find incidentalomas. Well, we don't find a lot. When you look at various studies, the rates of finding an incidental finding on a non-contrasted head CT, it's actually pretty low. We're not going to stumble into a bunch of pulmonary nodules that need follow-up. So from a test standpoint, a head CT on an elderly patient is unlikely to set us off on some diagnostic misadventure. The other piece of the puzzle is radiation. Yes, you get some extra radiation from a head CT. Elderly patients, their chance of developing a fatal malignancy from that one-off head CT is approaching zero. So the rate of bleed in a patient who falls and says, I don't know if I hit my head, when you're looking at elderly patients, is about 1.7. And it's important to remember, in that patient population, there's a 0.3% chance the patient has a bleed that someone needs to operate on. So I think there are a lot of times in the ED where we can say, I just think you're fine. I think the risk of us finding something is low. I would argue based on this paper that the well-appearing elderly patient who doesn't know if they hit their head is not necessarily the patient to not order tests on. I'm gonna have a much lower threshold to order these patients. And to everybody out there, best of luck with the upcoming election.
This is Hippo Education.